Hey, it's the nursing professor here. In celebration of February, which is Heart Awareness Month, let's talk about heart failure, which is one of the more common illnesses that we see today. All right, so when we talk about heart failure, we're talking about a condition that results from the heart's ineffective ability to pump and manage blood and fluid in the way that it was supposed to be managed. And so we have two types of heart failure primarily. We have left-sided and right-sided. So left-sided heart failure is the most common form, and in left-sided heart failure is that the blood and fluid backs up so much that it's going to impact the lungs. So left and lungs. All right. So when you think of it like that and you have questions that are associated with it, then you should be able to determine which side is which. And so right-sided heart failure is when blood and fluid backs up so much that it impacts the rest of our body. So typically the symptoms you will see is swelling in the lower extremities. You know, people don't even look like they have an ankle, or their abdomen. You know, sometimes you'll see people and they're like, oh, I'm gaining weight around my abdomen. And in reality, when you're doing an assessment of it, you may find that there's fluid buildup there. Also, people who are not gaining weight anywhere else and they notice they can no longer, you know, button their pants in the way they might have done it before, and it's only around the waist. That might be a sign or symptom of right-sided heart failure. All right. And so when we talk about heart failure, nurses play very key, essential roles to it, because some of the management of the illness is lifestyle changes that need to be done. And so it's our responsibility in teaching our patients about those lifestyle things, as well as educating them on the multiple medications that they may have to take. All right. So some causes of heart failure include coronary artery disease. You know, people go to the doctor and they say their cholesterol is up. Well, cholesterol is like a sticky substance. It's like sludge that lines the vessels. And so you can only imagine, if you think of a pipe that has some kind of buildup, it's going to prevent the free flow of fluid in a manner in which it's supposed to. So cholesterol actually does that to our vessels, and therefore impedes our heart performance. So many times we need to make that correlation between elevated cholesterol and heart failure to our patients, such that they'll take it seriously. A heart attack is caused by a clot that closes off circulation to a portion of the heart where the tissue actually dies. That can also lead to heart failure. High blood pressure, especially poorly treated blood pressure, where a person may not be as compliant with taking their medications because they just don't. They don't like the way the blood pressure medicine makes them feel. Cardiomyopathy. This frequently results from when the heart has to work so hard, then it builds up and it gets bigger, and it doesn't get more efficient, but it gets bigger. And so that can create problems down the road. Heart valve disease, where the valves between the ventricles and atrium, they're not closing and opening and closing in the manner in which they're supposed to. And arrhythmias, a common one is SVT, supraventricular tachycardia, or afibrillation. And so we need to get those rates controlled so that adequate blood flow can go to the heart and come out of the heart. Because you can imagine, if all of that is happening so fast, it's not an adequate blood supply. Okay, so all of those are causes of heart failure. All right, moving on. What you're going to see. What are the symptoms? Shortness of breath, which is also known as dyspnea. Fatigue and weakness. Person's just like, ooh, I just don't have any energy. Orthopnea. This is common. When you're doing a head-to-toe assessment, ask your patient how many pillows they find themselves sleeping on. Because sometimes it's something as little as that. Like now they need 3 pillows to sleep on, where they used to could sleep flat or had only 1 pillow. And what orthopnea means is that the person needs to be sitting more upright in order for them to get adequate respiration. Swelling in the legs, ankles, ascites, abdomen. You know, we talked about that a few minutes ago. JVD, where you start to see the jugular vein, it literally sits out, you know, from the neck, where you're able to see that it's sometimes literally even bulging. Weight gain, unexplained weight gain, nocturia, people waking up more in the middle of the night to go to the bathroom. Anorexia, nausea is very common, especially towards the end stages of heart failure, because it takes energy to eat. It takes energy to eat and digest food. So you can imagine if the heart is not working efficiently, then that's some of the fatigue that a person might see. And so untreated, that's going to cause a cascade of events that really can get this person in trouble. All right, a cough and wheezing is frequently seen as well. And when people with heart failure have a cough, frequently, if they're able to bring up sputum, it's kind of pink tinge because it's literally coming from excess fluid in the lungs. Okay, so moving on, how can we treat this bad boy? All right, lifestyle changes, recommend diet, exercise, weight management, smoking cessation, and minimizing or stop drinking alcohol. Those are all lifestyle changes that we're going to recommend to our patient. Some of the lab tests that we will see, or some of the assessment tools that we might use and help diagnose a person, is a lab test called a BNP. That number is usually very elevated if a person is in heart failure. Also looking at their electrolytes, because many times people can become dehydrated and electrolytes will actually decrease. BUN and creatinine, make sure that their kidney functions are okay. Liver function test, because remember we talked about the ascites and that we want to make sure that the liver is actually processing so that those liver enzymes don't get elevated. ABGs, especially if a person has difficulty breathing, to really get an accurate assessment of their oxygenation. Those are arterial blood gases. Chest x-ray can tell the status of their lungs. Echocardiograms, EKGs, cardiac MRIs, a stress test. You know, frequently a person will be recommended to have a stress test, and they will literally watch their heart be unable to handle it when their body is challenged, like the machine says to walk a little faster or try to do a little light jog or something like that. And frequently also a cardiac catheterization can also identify that. Okay, so that is assessment. That is some lifestyle changes that we can recommend. All right, so medications. These are classes of drugs that you really do need to know, and the best way to learn them is to learn them by classes. With all of these, you want to make certain that you're monitoring vital signs, blood pressure, heart rate, because as they work on the heart, then they're also possibly lowering the blood pressure and maybe lowering the heart rate as well. So first class would be your ACE inhibitors. Those are going to be medications that end in pril or PRIL, like lisinopril, acupril. Now these drugs help to relax the blood vessels in order to allow for better blood flow. The chief thing to remember about ACE inhibitors is that sometimes people can be on them for years. And for some reason, they will have an allergic response one day where typically it's angioedema, and that's when you have swelling of the mouth, the tongue, lips, and it can be a medical emergency. All right. ARBs, ARBS, or angiotensin II receptor blockers. That's another class of drugs. And they work pretty similar as the ACE inhibitors to relax the blood vessels. However, they don't have as many side effects. So sometimes if a person has had trouble with the ACE inhibitors, then the next step would be that they will give them ARBs. And these drugs end in TAN, like losartan would be an example of one. Beta blockers. Beta blockers work to lower or slower the heart rate. They can also make the blood pressure go down. And so they work to lower the heart rate by the effects that they have on norepinephrine and epinephrine. That helps the heart rate lowers. So they work really well, especially for people who have things like SVT or supraventricular tachycardia, with heart rates really beating fast, or afibrillation. Those medications can be used for that. And those drugs typically end in LOL, like laugh out loud, like your metoprolol. That would be an example. Diuretics are like fluid pills. Most people know them as fluid pills, where they make you go to the bathroom frequently so that you can release some of that excess fluid. As a nurse, you want to make sure your patient knows to take those medications earlier in the day so it won't interrupt their sleep time at night. And examples of those would include furosemide, most common, and hydrochlorothiazide. So we want to make sure that our patients understand that. Now, with the diuretics, frequently we need to be concerned about lower electrolytes, in particular potassium. And so we want to monitor a person's potassium levels, but it also can sometimes affect other levels like magnesium as well. The aldosterone antagonists are another group, in that they also manage fluid retention and can prevent further damage to the heart. Then we move on to digoxin, which typically is a little lower on the totem pole. People don't really reach for that, or providers don't reach for that as early on in the treatment of heart failure, because it has so many side effects. In particular, you have to monitor blood levels to ensure the person doesn't have any toxicity or the levels don't get too high. And some of the symptoms of toxicity include nausea, vomiting, and visual disturbances, including like a blue halo. People will report that. And last but not least is your vasodilators, and just as it sounds, it dilates the vessels, making it easier for the heart to actually pump the blood and fluid. And so as a nurse, you would want to make certain that you are instructing your patients to change position slowly, so that they don't get that fast change of their blood pressure dropping when they're changing position and feel a little lightheaded or dizzy. Okay, so we want to make sure with vasodilators that we're teaching them to change positions slowly. And examples of that would be like nitroglycerin or isodil as well. All right, other ways we can treat heart failure are a host of devices like a pacemaker, ICD, which is implantable cardioverter defibrillator. That it means that it goes up underneath the chest wall, and it's able to detect when a person is in afibrillation and try to cardiovert it itself. But sometimes it doesn't work, and the person might have to go into the hospital, and manually they'll have a procedure that will actually convert them from afibrillation to normal sinus rhythm. Cardiac resynchronization, works along with pacemakers. It's actually a type of pacemaker, heart valve surgery, especially for those who have diseased valves, because the valves aren't opening and closing in the manner in which they're supposed to. So you get this backup happening there as well. CABG, or coronary artery bypass, especially when a person has a heart attack. You know, they bypass, meaning they take one vessel, they remove the diseased part of the vessel, and then they attach it to a new part of another vessel in order to improve circulation. An LVAD, or a left ventricular assistive device, is one of the last options, and it is literally like having a heart outside of your body. You'll see people wear these machines, and the machine actually is monitoring the person's heart, and able to detect when there are changes, especially changes that may result in fatality. Usually people have that device when they are waiting for a heart transplant, which of course is another option as far as treatment. And then some people select to have palliative care, because palliative care doesn't mean no care, but it means let me have less invasive care, and have improved quality of life. Because you can only imagine that if you felt like you were fatigued every day, couldn't breathe every day, couldn't walk 6 feet before you were short of breath, that's pretty poor quality of life. Okay, and so anytime you can get medication management to help improve that, then typically people will feel better, even though it might not be improving the function of the heart. All right, so that is all about heart failure. Hopefully that was helpful to you. If there's any questions, please put them down below and I will be sure to answer them. Please like, subscribe, and share this video. And let me know what your thoughts are, because cardiac, I love it, but sometimes it can be very challenging to students, and I hope I made that a little more simple for you. All right, bye for now.